This is a NCLEX Practice Test for Management of Care. This practice test covers the content area of management of care, which includes topics such as delegation, discharge planning, infection control, and more. Let's get started. 1. Which of the following is an example of the intervention phase of the individualized nursing care plan for a client who receives a colostomy after a bowel resection? A. Taking a health history and performing a physical exam prior to the procedure. B. Instructing the client about how to care for his colostomy stoma. C. Developing goals that state the client will ambulate 3 times a day. D. Determining that the client may need more support at home after dismissal. Correct answer: B. Instructing the client about how to care for his colostomy stoma. The intervention stage of the individualized nursing care plan is the point of care in which the nurse provides care, treatments, or education to help the client meet the devised outcomes. Instructing the client about how to care for his colostomy stoma supports the process of helping the client to meet the outcomes designed for this case, to care for his colostomy after a bowel resection. 2. Which of the following is an example of a living will? A. A client's son has been appointed to make his healthcare decisions if he becomes incapacitated. B. A client has designated which of his children will receive his home and property before he dies. C. A client has instructions that he does not want to be resuscitated through chest compressions if his heart stops beating. D. A client designates what type of burial or cremation services he would want after his death. Correct answer: C. A client has instructions that he does not want to be resuscitated through chest compressions if his heart stops beating. A living will is a type of advance directive that a client develops to stipulate his preferences for healthcare in the event that he is unable to do so. A living will involves instructions about various situations that may occur and the client's preferences for treatment in each case, which may involve using or discontinuing life-saving measures. 3. What is involved with obtaining informed consent? A. An explanation of the reasons for the procedure. B. A signature on a form that states the client agrees to the procedure. C. A statement affirming liability if complications arise during the procedure. D. Both A and C. Correct answer: A. An explanation of the reasons for the procedure. Informed consent is the process of explaining the reasons for the procedure, the risks, benefits, and alternatives. Although the nurse may have a client sign a consent form indicating agreement, actual informed consent occurs when a physician has a discussion about the procedure with the client to educate him about the process. 4. Which of the following questions must the nurse ask when formulating a nursing diagnosis? A. What diagnosis did the physician make for this client? B. What is the issue that I can solve for this client? C. What physician orders will resolve this issue? D. What underlying disease does this client have? Correct answer: B. What is the issue that I can solve for this client? When formulating a nursing diagnosis for a client, the nurse must remember to create a diagnosis based on the client's problems that she can meet through interventions. Nursing diagnoses differ from medical diagnoses in that the physician or medical provider diagnoses a client upon admission, but nursing interventions and related outcomes are based on nursing care of the client. 5. A client is being admitted to the stroke care unit of a rehabilitation center. Which of the following best describes the action of the nurse at admission? A. Collect and arrange documents to be placed in the client's medical record. B. Prepare the client's identification bracelet. C. Identify pertinent health history data as well as current needs and limitations. D. Gather the client's valuables and place them in a locked container. Correct answer: C. Identify pertinent health history data as well as current needs and limitations. Upon admission to a new care unit, the nurse's initial responsibility is to assess the client and identify any pertinent health history data that will affect his care. The nurse should also assess the client's needs and limitations, which allows her to formulate a nursing diagnosis as well as establish outcomes for this client while in her care. 6. A client is refusing to undergo any more treatments in the hospital and wants to leave against medical advice. When the nurse requests the client sign an AMA order, the client refuses and leaves. What is the next action of the nurse? A. Call security to hold the client until he will sign the order. B. Notify the physician to convince the client that he needs to stay. C. Speak with the client's spouse to persuade him to stay. D. Allow the client to leave and document the refusal in his chart. Correct answer: D. Allow the client to leave and document the refusal in his chart. The nurse cannot force the client to stay in the hospital to receive treatment or even to sign an AMA order. While she may try to use the physician or spouse to convince the client to stay, ultimately, the nurse should clarify the situation and document the client's refusal to sign the AMA form and file it in the chart. 7. The case manager is determining the discharge needs of a patient on a medical surgical floor in an acute care hospital. The patient is a 55-year-old male that was admitted to the hospital following a fall at work in which he suffered a left femur fracture. His past medical history includes CHF, COPD, DMI, and HTN. Which discipline's assessment would be a priority in determining the level of care needs for this patient? A. Nursing. B. Occupational therapy. C. Physical therapy. D. All of the above. Correct answer: D. All of the above. All of the above are correct. Nursing assessment would be important to determine the wound care needs upon discharge. Occupational therapy assessment would be important in determining the adaptive devices necessary to perform ADLs. Physical therapy assessment would be important in determining the strength of the patient and ability to return to optimum functionality. 8. Which example best describes a nurse who exhibits moral courage? A. A nurse feels angry when a parent refuses important treatment for his child. B. A nurse considers seeking help for depression when she feels she cannot meet the needs of her clients in the oncology unit. C. A nurse contacts a physician for further orders when he fails to order comfort measures for a client with a terminal illness. D. A nurse is frustrated when the laboratory is slow in responding to an order for a stab blood glucose. Correct answer: C. A nurse contacts a physician for further orders when he fails to order comfort measures for a client with a terminal illness. Moral courage involves taking action to do what is right, even when there might be negative consequences. The nurse who contacted a physician for further orders acted as a client advocate to seek help, even though she may have faced such consequences as lost time, decreased productivity, or criticism from the physician. 9. Which method is most appropriate for managing moral distress in the workplace? A. Recognizing that life is unfair and nurses cannot meet every need of every client. B. Declining to act when clients or visitors make requests that are not justifiable. C. Developing a new policy that would address the problematic situation. D. Both A and B. Correct answer: C. Developing a new policy that would address the problematic situation. Moral distress involves negative feelings or frustration toward situations that are deemed unfair, unethical, or that cause the nurse to feel helpless in her work. Moral distress can lead to nurse burnout when ongoing issues are not resolved. A nurse can work to manage moral distress by not only recognizing the potential for its development, but also creating policies that may help to change current standards, which can reduce the number of situations that create moral distress. 10. A nurse is required to float to another unit within the hospital where he is asked to care for a client on a ventilator. The nurse is uncomfortable with this assignment, as he has not had a ventilated client since nursing school. What is the nurse's most appropriate response? A. Explain to the nursing supervisor the level of discomfort and ask for a different assignment. B. State that the client's needs are outside the nurse's scope of practice and request a different assignment. C. Accept the assignment, asking for help when necessary. D. Request to return to the home unit and send another nurse who can perform the job. Correct answer: A. Explain to the nursing supervisor the level of discomfort and ask for a different assignment. When floating to another unit and asked to take an assignment that falls outside a nurse's comfort zone, the nurse should notify the area supervisor of the level of discomfort and request a different assignment. Caring for ventilated clients typically falls within the scope of nursing practice. However, discomfort with the situation may not necessarily be overcome by accepting the assignment. Alternatively, the effects could be harmful to the client if the nurse is unfamiliar with this type of care. 11. A nurse is asked to perform a task that she believes is outside her scope of practice. What is the appropriate response to this issue? A. Contact the State Board of Nursing Licensure to report the offense. B. Review the state scope of practice standards for nurses. C. Ask another nurse to perform the task to learn the procedure. D. Contact the house supervisor to make the decision as to whether the nurse should perform the task. Correct answer: B. Review the state scope of practice standards for nurses. There may be times when it is unclear if certain practice standards fall within the nursing scope of practice. Because guidelines vary between states, the nurse should review the scope of practice for nurses for this particular state to discern whether the action is permissible. If it is not possible to check the scope of standards herself, or if the standards are unclear, the nurse should then contact a supervisor. 12. The staff on a postpartum unit has been complaining to the nurse manager about certain nurses not fulfilling the required weekend shifts. To address the problem, the nurse manager implements new staffing guidelines that would require each nurse to work 4 weekend shifts per month. The implementation of these guidelines is an example of the following leadership style: A. Laissez-faire leadership. B. Authoritarian leadership. C. Democratic leadership. D. Servant leadership. Correct answer: B. Authoritarian leadership. The implementation of the staffing guidelines without any input from the staff is an example of authoritarian leadership. Often with this leadership style, punishment and negative reinforcement are used to implement rules. This style is often not well received by staff. 13. A nursing unit is implementing a new electronic charting program for the nursing staff to use. Which of the following best describes a disadvantage of using electronic charting? A. The information is more likely to be lost or used inappropriately. B. Any provider in the unit can have access to the client's medical records. C. The system diminishes communication between nurses and providers. D. The program may be confusing and difficult to implement. Correct answer: D. The program may be confusing and difficult to implement. A disadvantage to implementing a new form of electronic health charting on a unit is the complexity of the system involved. Starting a new system and expecting all staff to use it appropriately may take time and education for everyone involved. The system may cause confusion while all users practice learning how to navigate charting techniques. 14. A client has volunteered to take part in a research study. After participating for 2 months, he decides that he can no longer tolerate the study and decides to leave. What are the client's rights in this situation? A. The client has a right to be released from the study but must reimburse the researchers for charges incurred. B. The client has a right to be released from the study without any liability. C. The client has a right to be released from the study but is prohibited from participating in any future studies. D. The client does not have the right to be released from the study, he must finish his participation. Correct answer: B. The client has a right to be released from the study without any liability. If a client chooses to take part in a research study and then decides that he no longer wants to be involved, he may withdraw from the study in his own right. Forcing a voluntary study participant to remain in a research study violates his personal rights. 15. A client is seen in the emergency room as a victim of suspected domestic violence. The nurse's aide brings the client to a center curtained area, gives her a gown to change into, and asks her to wait for the nurse. What is the most appropriate action of the nurse upon arrival? A. Ask the client to undress to visualize any injuries. B. Take the client into a private room. C. Notify the police to file an initial report. D. Notify the house supervisor to keep security on alert. Correct answer: B. Take the client into a private room. A client who is seen as a possible victim of domestic violence should be given privacy in a safe room or location. Until the nurse can discern whether the case is the result of abuse or that the situation is unsafe, she should refrain from notifying authorities until she has more information. 16. Which example best describes the concept of beneficence? A. A client has an advance directive in place stating that he does not want intubation if he needs CPR. B. A nurse provides pain medication for a client in the recovery room who is experiencing pain. C. At the request of the client, a nurse does not inform his family about his cancer diagnosis. D. A nurse withholds narcotic medication for a client in pain, knowing that he is currently disoriented. Correct answer: B. A nurse provides pain medication for a client in the recovery room who is experiencing pain. Beneficence is the concept of doing what is good and right for the client. A recovery room nurse who cares for a client who is having pain after surgery follows beneficence when providing pain medication to make him more comfortable. 17. A nurse is at the beginning of her shift in a long-term care facility. Which of the following clients should she check on first? A. A 91-year-old man who needs help eating breakfast. B. An 86-year-old man who has been incontinent in his bed. C. An 82-year-old woman who needs 4 antibiotics. D. A 75-year-old man who is recovering from an injury who needs an ice pack. Correct answer: C. An 82-year-old woman who needs 4 antibiotics. When determining which client to see first while in a long-term care facility, the nurse should decide what tasks are most important that only she can do. If other assistive personnel are present, the nurse can delegate some tasks to continue to meet the needs of the clients. In this scenario, the 4 medication is the only task that must be done by the nurse. 18. The charge nurse is notified that the unit will be receiving an admission of a client from another bed in the hospital in order to make room for others being admitted through the emergency room. The unit is the Women's Health Center of the hospital. Which of the following people would be most appropriate to be transferred to this unit? A. A 26-year-old woman who had a bowel resection. B. A 40-year-old man who underwent a hernia repair. C. A 31-year-old woman with septicemia and who is on a ventilator. D. A 91-year-old man with Alzheimer's disease recovering from a fall. Correct answer: A. A 26-year-old woman who had a bowel resection. When making decisions about the transfer of clients between units in the hospital, the nurse must decide on the most appropriate person to be transferred based on the client's condition, the staffing levels of the unit, and the purposes of the unit overall. The women's health unit of a hospital would accept female clients that do not require intensive or 1:1 care. 19. A 22-year-old patient has been declared to have experienced an irreversible cessation of brain activity following a motor vehicle accident. The nurse has the legal obligation to address organ donation with the family. The nurse's priority action at this time would be to A. Determine who is legally responsible to provide consent. B. Provide a private area where the family can discuss organ donation. C. Notify the physician of the patient condition. D. Notify Center for Organ Recovery and Education, CORE. Correct answer: D. Notify Center for Organ Recovery and Education, CORE. The priority action by the nurse would be to notify CORE of the patient's condition. The next action would be to provide a private area where the family can discuss organ donation and determine who provides consent. 20. Examples of preservation of self-integrity include all of the following except A. Using assistive equipment to move bariatric clients. B. Participating in wellness programs. C. Accepting the challenge of caring for clients with oppositional beliefs or practices. D. Using hand hygiene and personal protective equipment. Correct answer: C. Accepting the challenge of caring for clients with oppositional beliefs or practices. Preserving self-integrity involves taking care of oneself in order to maintain positive nursing practices and to avoid burnout. Self-integrity involves self-care and is manifested in actions that protect or support the nurse. If barriers exist within care settings that are too challenging for nurses to overcome without sacrificing their integrity, they should request a different assignment in order to uphold their own self-care. 21. Which of the following is an example of intragroup conflict? A. A nurse writes a grant for a nonprofit organization to raise money for advertising. B. Members of a multidisciplinary team cannot agree on the best course of action for a client. C. A client does not receive his medication on time because the nurse was on break. D. A nurse feels frustrated that her employer does not provide on-site child care. Correct answer: B. Members of a multidisciplinary team cannot agree on the best course of action for a client. Intragroup conflict occurs when disagreements happen between members of a same group. Various professionals serving on a multidisciplinary team may develop intragroup conflict if those involved cannot agree on a decision of how best to care for a client. 22. What does an anti-kickback statute prevent? A. It prevents healthcare workers from providing food or parties to celebrate special occasions at work. B. It promotes thorough and complete documentation when a client becomes injured. C. It forbids giving or accepting gifts to promote or provide referrals for certain services. D. It prevents physicians from ordering treatments that may require nursing care that is over and above the usual amount. Correct answer: C. It forbids giving or accepting gifts to promote or provide referrals for certain services. An anti-kickback statute prevents healthcare providers, clients, consultants, or related organizations from giving or accepting gifts in order to reward others for referring services. Organizations that provide gifts of food, donations, or personal items targeted toward nursing staff in exchange for referral of services are violating this statute. 23. The nurse working at an acute care hospital is transferring a patient to a skilled nursing facility. The patient's vital signs documented at 1400 R, T 37.5 degrees Celsius, P 88, RR 16, BP 135/70, SP 0293% on RA. The following vital signs documented at 1800, just prior to discharge, are as follows: T 38.5 degrees Celsius, P 102, RR 18, BP 158/82, SP 02-91% on RA. What should be the nurse's next course of action? A. Discharge the patient, but notify the skilled nursing facility of the patient's change in status. B. Discharge the patient, but notify the physician of the patient's change in status. C. Delay discharge and notify the physician of the patient's change in status. D. Delay discharge and notify the skilled nursing facility of the patient's change in status. Correct answer: C. Delay discharge and notify the physician of the patient's change in status. The nurse would not continue with the discharge process if there has been a change in patient status. The patient must be stable in order to be discharged safely. However, the nurse must notify the physician immediately with the changes prior to notifying the skilled nursing facility. 24. Which of the following is an example of intrapersonal conflict? A. Hospital bills are denied by an insurance company due to policies. B. A nurse is called to testify in court about a client she cared for 3 years ago. C. A nurse feels guilty when she administers essential medication that causes a client to have nausea and vomiting. D. The spouse of a nurse is upset that she is working overtime. Correct answer: C. A nurse feels guilty when she administers essential medication that causes a client to have nausea and vomiting. Intrapersonal conflict involves negative feelings or frustrations within oneself. Intrapersonal conflict may be related to decisions or actions that clash with personal morals or beliefs. A nurse who feels guilty about administering important medication that involves negative side effects may be struggling with interpersonal conflict. 25. A nurse with 5 years of experience working in a hospital unit is promoted as a mentor and preceptor to a new nursing staff. This is an example of A. Collegiality, B. Competence, C. Advocacy, D. Integration. Correct answer, A. Collegiality. Collegiality is the action of forming relationships and supporting others through work experiences. A nurse who becomes a mentor to other nurses fosters an encouraging educational relationship with those she mentors by demonstrating appropriate nursing care. Nurses who act as preceptors often teach skills to new nurses, further advancing educational goals and activities. 26. Which of the following is an example of libel? A. A client overhears a nurse telling her assistant that he is too high maintenance. B. A client reads disparaging remarks that a nurse has written about him in his chart. C. A nurse fails to notify a physician when a client's hemoglobin level is 8.1 gm/dl. D. A nurse administers narcotic pain medication to a client in pain but does not have an order. Correct answer, B. A client reads disparaging remarks that a nurse has written about him in his chart. Libel involves statements against another person that are in written form. The information injures the other person's reputation or feelings. Libel occurs when a client reads negative remarks about himself that were made by the nurse and were written in his chart. 27. All of the following are essential components of supervision except A. All tasks to be delegated or supervised are within the nurse's scope of practice. B. The necessary tasks require repeated assessments. C. The nurse has adequate time to develop staff assignments. D. Policies have been developed that govern nursing practice. Correct answer, B. The necessary tasks require repeated assessments. Nursing supervision of staff requires several components that must be in place in order for the nurse to provide adequate management. The nursing actions should fall within the nursing scope of practice and should be governed by the appropriate policies. Adequate staff must be available to perform the necessary work, but each task should not require repeated assessments to be completed. Repeating assessments negates the need for delegation when the nurse must follow through on the delegated work. 28. Which of the following is an example of a breach to a client's right to privacy? A. A nurse who is not caring for the client reads his personal information in his chart. B. A client is not allowed to keep a copy of his original medical record. C. A nurse filed an incident report about a client that was reviewed with all staff at a meeting. D. A client's photograph was used without permission for the hospital newsletter. Correct answer, D. A client's photograph was used without permission for the hospital newsletter. A client's right to privacy includes his right to receive treatment without interfering with his personal information in a manner that is above and beyond reasonable levels. This includes a client's right to be left alone during his care. Photographs, information about the client's name or background, or otherwise encroaching on a client's private information are all breaches of privacy if not given permission. 29. Which of the following abides by the Americans with Disabilities Act of 1990? A. A nurse is allowed to have a leave of absence to recover after a back injury. B. A nurse manager cannot cancel an interview with a potential employee because he has left-sided paralysis. C. A nurse is mandated to receive 12 weeks off of work after having a baby. D. A nurse manager must hire a nurse who uses a walker for mobility. Correct answer, B. A nurse manager cannot cancel an interview with a potential employee because he has left-sided paralysis. The Americans with Disabilities Act of 1990 provides accommodation for persons with disabilities in that employers cannot discriminate against a person because he is disabled. The Act protects the application and employment process of people with disabilities. While a nurse manager cannot discriminate against someone for having a disability by failing to interview, this Act does not require employers to hire a person with a disability if he is not qualified. 30. A patient that is post-op day 3 from a total knee replacement informs the nurse that he lives alone and has 2 sets of stairs in his home. The following action taken by the nurse would be appropriate after gathering the above information. A. Notify the physician. B. Notify the social worker. C. Arrange for a family member of the patient to stay with the patient. D. All of the above. Correct answer: B. Notify the social worker. The nurse has the responsibility to make a referral to a social worker following this interaction with a patient. It would be unsafe for the patient to be discharged to home without any assistance. The social worker will be able to further assist in the discharge process according to the patient's needs and insurance coverage. 31. Because of budget cuts in the hospital, the nursing manager informs the staff that they must either float to other units more often or take their turn staying home from work. Which principle is this nurse manager demonstrating? A. Justice. B. Paternalism. C. Veracity. D. Fraternity. Correct answer: C. Veracity. Veracity involves truth-telling, even when the situation is difficult. Staff nurses have a right to know if their shifts will be changing, which may eventually affect their pay or the areas in which they will be expected to work. The nurse manager is demonstrating veracity by giving them notice of the upcoming changes. 32. A new nursing unit is opening in the hospital. In order to meet the staffing needs of the unit, nurses from other areas will be moved and required to work in the new area. When notifying the nurses chosen to staff this area, the nurse manager states, "You will either move to work on this unit or you will no longer be employed at this hospital." Which of the following strategies is this nurse manager using? A. Manipulation. B. Facilitation. C. Co-optation. D. Coercion. Correct answer: D. Coercion. This nurse manager is using a coercion tactic to convince nurses of their job changes. Coercion involves using power to force others to make a choice. In this example, the nurses must choose to work on the new unit or they will lose their jobs. 33. A group of nurses who work on the Quality Assurance Council of a unit have gathered to discuss ideas about how to educate their coworkers about Joint Commission requirements. Each of the nurses gives ideas, which are listed together without initially criticizing any of the suggestions. Eventually, all ideas on the list will be discussed as to their validity. This activity is known as A. Optimizing. B. Satisficing. C. Brainstorming. D. Centralizing. Correct answer: C. Brainstorming. Brainstorming occurs when members of a group throw out ideas for possible solutions. The ideas are not initially discussed or criticized as being valid or convincing, they are instead listed together as a collection of thoughts or plans. Once all ideas have been suggested, the team can then discuss the practicality of implementing some of the ideas. 34. An assisted living facility is an example of which type of healthcare provider? A. Primary care. B. Secondary care. C. Tertiary care. D. None of the above. Correct answer: C. Tertiary care. An assisted living facility is an example of a tertiary care provider. A tertiary care provider is one that provides rehabilitation or long-term care after a client has practiced prevention of illness or has been treated for disease. 35. Which of the following statements is true regarding nonprofit organizations? A. They are located in poor or rural areas to provide care to the largest number of people. B. They are mandated to care for people, even if clients are unable to pay for services. C. The money they receive for services is divided among stockholders that have invested in the organization. D. They are also called proprietary organizations. Correct answer: B. They are mandated to care for people, even if clients are unable to pay for services. Nonprofit organizations are those that return the money they receive from clients into their own business in order to develop further services. Nonprofit organizations may be located in any areas, but if their services involve care of others, they are required to provide care regardless of whether the client can pay. There are many hospitals, community clinics, and healthcare educational organizations that are considered nonprofit. 36. Which of the following is a function of risk management? A. To consider the problems that arise if errors happen and their effect on the healthcare environment. B. To identify how nursing care responds to specific client problems. C. To view clients as customers and decide what actions will provide a satisfying healthcare experience. D. To analyze physician-nurse relationships and determine where collaboration efforts can improve. Correct answer: A. To consider the problems that arise if errors happen and their effect on the healthcare environment. The Risk Management Department of a healthcare organization looks at potential losses and how they could negatively impact the organization. The department also works to implement strategies that will minimize these losses, thereby providing cost savings to the organization as a whole. While not all nurses will work specifically within the Risk Management Department, all nurses play a role in risk management by monitoring their own work to minimize losses in each of their own areas. 37. Which of the following is an example of effective time management? A. Always agreeing to others' requests for help. B. Arranging long meetings to discuss important data. C. Using multiple forms of technology to communicate or educate others. D. Working in a secluded area to minimize interruptions. Correct answer: D. Working in a secluded area to minimize interruptions. Effective time management skills are essential to accomplishing daily goals and providing adequate care for clients without becoming overwhelmed. Time management practices may be as simple as working in an isolated area to chart or catch up on paperwork in order to avoid becoming distracted or being interrupted. Responding to all requests for help, arranging long meetings, and submitting to information overload through various forms of technology all contribute to ineffective time management. 38. What is the relationship between HIPAA and technological advances? A. Technology helps to foster HIPAA confidentiality. B. Computers help us to share information with others. C. Computer screens are not visible to others in the area. D. Technology places us at risk for HIPAA violations. Correct answer: D. Technology places us at risk for HIPAA violations. Technology places us at risk for HIPAA violations. For example, not logging off and having the computer screen in the view of others can lead to HIPAA violations. Although computers do help us share information with others, this has nothing to do with HIPAA when they are used properly. 39. Which technological advance is most likely to place you at risk for HIPAA violations? A. Social media. B. Word processing programs. C. Spreadsheets. D. Clouds and SOEs. Correct answer: A. Social media. Social media, like Facebook, can place you at risk for HIPAA violations. No patient-related information or comments should ever be put on social media websites. 40. A physician is explaining a procedure to a patient that may cure her recurring staph infection. The doctor explains how the procedure is done, what to expect, the odds of the procedure curing the infection, and possible side effects and risks. The physician is A. Preparing the patient to give informed consent. B. Protecting HIPAA by listing all of the steps of the procedure with the risks involved. C. Not required to inform the patient of any alternative therapies. D. None of the above. Correct answer: A. Preparing the patient to give informed consent. Giving informed consent is the process of giving a physician permission to perform a procedure after all of the risks are made known to the patient. Informed consent is required in most cases, but may not be necessary in some emergency situations. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.